Hi everyone, my name is Kimberly and I'll be presenting on achondroplasia. Achondroplasia is a genetic disorder. It is an autosomal dominant disorder caused by a mutation in the allele of the short arm of the chromosome 4, affecting the receptor protein for fibroblast growth factor 3. Achondroplasia is passed down from parent to child, but in 80% of the cases, it is a result of spontaneous mutation. Currently, there are no integrated AI models for achondroplasia diagnosis, but there is a preliminary work in the field. It has been used to analyze radiograph images of infants and has shown great promise in early diagnosis. Here I have an image representing chromosome 4 being affected on that short arm part, as well as that one specific part of the gene that is affected by the mutation. In terms of demographics, it will be defined by the total number of achondroplasia cases in a predefined population divided by the size of that population and multiplied by 100,000. Asia and Oceania with 10.58 out of 100,000 births diagnosed with achondroplasia. Sub-Saharan Africa, 12.6 out of 100,000. North Africa and the Middle East with 34.31 out of 100 births diagnosed with achondroplasia. South America with 3.2 out of 100,000 births. North America with 4 out of 100,000 births. And an average worldwide of 4.73 out of 100,000 births. We can see North America falls closer to the worldwide average with 4. And we see Sub-Saharan Africa being a dominant location demographically with occurring achondroplasia diagnosis. In terms of anatomy, I have a child and I have an adult presenting key features of achondroplasia. We have macrocephaly, which is a larger head, frontal bossing, which is a broad forehead, mid-face hypoplasia, which is the small nose bridge, rhizomelia, which is the proximal portion of the limb, is shorter than the distal portion. You can see this in the child and the adult, where the portion where the bicep is shorter than the portion where the forearm is. We also have brachiodactyly, which is short digits with the gap between the ring and middle finger. This is also named trident hands. So where the index and the middle finger become one region, the ring finger and the pinky is another region, and the thumb is the third region, which is why it's named trident hand. Have the radial head subluxation, posterior bowing of the humerus, thoracolumbar hypophysis, lumbar hyperlordosis, and genu-varum, which is that bowing of the legs, which we can see more clearly in the image. We can see that bowing of the tibia as well. So there's an overall bowing of the legs of the individual with achondroplasia. In terms of physiology and symptoms, on average, the height of a male is 4 feet 4 inches, while on average, the height of a female is 4 feet 1 inch. Achondroplasia affects the formation of cartilage into bone, which is why it causes the following symptoms: hydrocephaly, which is water in the brain, sleep apnea, hearing impairment, foraminal stenosis, crowded misaligned teeth, reduced muscle tone, and laxity of the joints, which is hyperflexibility of those joints, pseudoclaudication, childhood obesity, and on average, someone with an achondroplasia diagnosis has an average life expectancy. We can see an example of a child's x-ray here, where that proximal aspect of the limb is shorter than the distal. We can see the macrocephaly as well with the larger head, and we can see an exaggerated curve in the spine as well. The bowing of the legs is also evident here, even in childhood. Diagnosis and treatment. So diagnosis can be made through fetal ultrasounds. These fetal ultrasounds, if characteristics of achondroplasia are found, then a genetic test would be performed. This is where the amniotic fluid is tested to look for the defective gene, and after the baby is born, an X-ray can be taken to measure the baby's bones and blood tests taken. There's no cure for achondroplasia, but symptoms can be managed through surgeries. For instance, bone of the legs can be surgically straightened through surgeries, elongation surgeries to add height as well, and in some cases, growth hormones are used to accelerate the growth in a child's bones. Antibiotics are also used for the frequent ear infections that someone can also suffer from when diagnosed with achondroplasia. And these are all of the references for the pictures and for my information. Thank you.